So Dr. Swanz, we're going to be cleaning you off with peroxide and Hibiclens because I'm very paranoid about infection.
Okay. And you have to do multiple injections?
Yes. You have to do multiple injections because you're showing me that you have multiple areas of inflammation and strain. And your problem is that you probably work out too hard and never let this heal.
I took like 8 weeks off. No, probably longer than that.
Dr. Swan, did you tell me that you just worked out right before you came here?
Yeah, I did this morning, but...
Did you want to see this?
Yes, he wants to. You can't do it on there, it's not level.
So now you're just...
Now we're collecting the platelet-rich plasma from the blood that we've just drawn out of your body and put in a centrifuge. And the centrifuge process is what separates the blood into layers. And that middle little stripe that you see,
Right.
that's your platelets between the yellow and the dark blood.
And so what you're doing now, you're pulling it through, and what, is there some kind of filter that's going to...
Well, this tube that's right here,
Right.
it goes down and it's like just open right there on the top of that
Gotcha.
level. So it's sucking out the plasma that's on top. It's sucking out what's on top. So once it gets to, you'll see it in just a second.
Right there, you're going to swap it.
So right now, what is in right here is the platelets.
Cool.
So we wait until the red gets to right there, and then we switch it to where it's going to come into here.
Cool.
So now all the platelets are here, and on that in the red part too. So we're just going to take them out and put them into a separate syringe.
And that's what you get to inject.
Mm-hmm. Yeah, and then I'll give him the the plasma too, because it does have some platelets in it and some good regenerative stuff.
Cool.
So just in case he needs extra.
So this is an anesthetic to numb it. Don't film me from something.
Not that corner here. Skin wheel. And then up your skin.
Stings a little bit.
We're going to go spot inside the joint.
Woo!
There we go. More in. Now we're in the joint. We're putting a little numbing medicine inside the joint.
I can feel that already starting to work.
Doing okay?
Yeah, man. I'm fine. No, it doesn't hurt. So how much did you put in?
1 cc. And then we're going to numb up your skin and do a few skin wheels. And then I'm going to go back straight with the PRP.
Okay.
And then I might touch you up with some more Prolog too. Just
Okay. Yeah, I mean that whole medial side is...
all this area.
Yeah, like right around on those points. And that's all where MCL attaches, right? And there's just like meniscus. And,
This whole area.
Yeah. That's pretty much it, right?
Yeah. Here.
Up on to the bone, yeah. I mean, like, that's not quite as bad. Yeah, like right up on
Don't touch it for me.
I won't touch it.
Alright. Let's do some skin wheels. This is the part that hurts the most.
Yeah, a little stingy.
Some people don't do skin wheels. Dr. J thinks that this hurts more.
Than just doing
and it's not worth it. And I can do one without it. And you
That's
can
a really sore spot. That's a sore spot.
And what's the difference between doing them and not doing them?
Well, this is some numbing medicine, so when I put that needle in, I think he'll hurt a little bit less.
Okay.
You hurt down here.
And I mean, but I'm not sure if that's because I literally bumped my shin
I know
yesterday.
you hurt here. Yeah, but right.
Yeah, I mean, but that's
That's where the bump is.
yeah, that's from walking straight into that.
You weren't having pain.
No,
here
it's
before.
really more on that medial side.
Anything here or behind the.
Not really. No, it's definitely more in the joint. I felt a little bit like on the lateral side, like it was kind of almost, like the head of the
Here,
fibula or something.
here.
Yeah,
That's fibula.
yeah, like almost right around in there where it came down. But I didn't know if that was because of
I'm not. Am I hurting you or not?
come up a little bit more maybe, like towards the ceiling, like more.
Oh.
Yeah, like right up in there, kind of,
Does this hurt?
Yeah, and it's kind of numb too. It feels a little numb, but yeah, that feels a little more like that sore stuff. Numbed it up. You get all that, video lady? Superman doesn't cry.
Superman doesn't cry. That's right.
Yep, I changed my shirt right before I walked out of the house. But I can't.
That's good. Good thinking.